everyone. Welcome back. It's so good to have you here. It's an early morning in Thailand right now, and we have another guest to present to you. This is going to be a really exciting conversation because it's actually something that we haven't talked about addressed directly. So I think this is such valuable content, and we have a really wonderful person to have this conversation with. So let's get started. I'm going to tell you a little bit about Dr. Anna Redmond. She's a trained clinical psychologist with specialties in health psychology, chronic pain management, and she is board certified in biofeedback as well. She has over a decade of experience listening to women, their chronic pain stories, and moving them to a path of recovery. Today, she comes to us as a chronic pain educator who has honed the most impactful education for women to view their pain through a new lens, changing their behaviors and reshape their lives to match what they really want. With education, she helps women dive deeper than a diagnosis and their symptoms to connect with themselves on a heart and brain level so they can stop fighting with their bodies and design a life that is bigger than their pain. So welcome. It's so wonderful to have you here chatting with us today.
Thank you so much for having me. I've been following you and enjoying all of your content, so I'm very honored to be sitting here with you.
Thank you so much. We also have been following you. It's so amazing to network with and connect with different creators, and just like I feel like it's a treat. It's like this free daily education, inspiration, encouragement, and yeah, we love what you're doing. So I'm super glad you're here today.
Right back at you. Thank you so much.
Well, we'd love to hear kind of the tagline for our podcast is like, your story matters. And we'd love to hear you kind of bring us through your story. And so much of what we do as humans when our jobs are about our passion is like connected to our story. And that's definitely the case for us. And we know that's the case for you too. So yeah, just take us through your story and we'd love to hear it.
Sure, thank you. I actually had to get used to telling my story. When they train you as a therapist, telling your personal story is not usually part of that picture.
Right.
But I think in this case, it's really important. And I always like to start by saying that in no way do I claim to have someone else's pain, their same pain experience, because honestly, in fact, most of the people I encountered along the way have had pain for 5, 10, 20 years, decades. And so from a time perspective, I'm really just a sliver of that. But I do believe that my story highlights what so many people experience right at the outset of their chronic pain journey. So I talk a bit about that, what that looked like for me, what I wish my provider had done differently, and then kind of where things went from there. But it started like most people, I looked to the medical system for answers. I was having this neck pain that just wouldn't go away. I went to my primary care doctor, told her about my neck pain. She ordered x-rays and MRI. I went to her office for the results. And so she had my imaging up on her computer screen, and then she had the spine model and explained that I had a bulging disc in my neck and exactly what that was. She thought maybe it was a whiplash I experienced while trying to learn how to snowboard as an adult. Maybe my posture at work or certain weak muscles in my body. And she referred me to a physical therapist. So I saw, and I was a pain psychologist on a pain team. So I kind of had these connections, and I saw several physicians and a physical therapist, and I tried all of the things. And so here's where language really comes in and is important. I just want to point out this part of my story where one, she told me that if my pain didn't resolve, that I might consider speaking with a spine surgeon. And so talk about fear-inducing spine surgeon. So just those words, right? And so then I'm very fearful of this diagnosis she's just given me, which even just the names of some of these diagnoses can trigger that sometimes.
Yeah.
And second, so when I heard those words bulging disc from my primary care doctor as she's holding up the spine and I've got this imaging on the screen, I was immediately awash in fear, and I just couldn't get that image of my bulging disc out of my mind, sort of this faulty tissue in my body that would never get better and could worsen with age. And so even though I was a pain psychologist, I felt myself jumping to the worst case scenarios. And just this
Yeah.
one visit instilled so much fear in me about my body.
Mm.
Um, and I think for a lot of people with chronic pain, this whole scenario where we present to our provider's office, we get the tests, the diagnoses, the scans, but there's usually little acknowledgement of anything else, and this is so common. And so what's happening here is that the biomedical model is really set in place. So we learn pain is due to some sort of tissue damage or something's wrong physically in the body. The language is often fear-inducing. The provider's focusing on fixing, in my case, the bad disc, and a patient then, they're looking for the medical system for answers, hearing there are things to try, and so then they hope that the treatment or the fix will make it go away. Patients spend years of appointments, labs, tests, interventions, procedures, surgeries, physical therapy, all of these things, often with disappointing results, because there isn't one fix or one thing that consistently cures chronic pain for all people. And also because pain isn't just a physical or a biomedical thing, especially
Right.
after someone's had it for more than a few months. Pain is always biopsychosocial and lives in the overlap of a person's unique biological, psychological, and social factors. And so when we go to the doctor and they approach it strictly physical or in a strictly medical way, then what happens when the normal treatments don't work? Like, I'm a doer and I'll do anything my doctors tell me to do, but then what does that mean if they don't work? Or what happens when we look at my imaging and there's nothing there to say why I have pain? And so what happens is, and what it felt like for me, is that patients are left to feel invalidated, marginalized, like their pain isn't real, like they're a burden. And this is just one visit, right? And then what
Yeah.
came from that one visit. And another thing so this is the part where that I had to get used to telling, like, so what else was happening in my life at the time, the context, because context is important. I had this great job on paper. It was fast paced, it was challenging. I worked with all kinds of really talented people in a large medical system, but it wasn't a good match for me. It felt toxic at times. I was seeing patient after patient, pushing past my limits. I was a perfectionist, a people pleaser. I pushed through all of my physical symptoms. And as this comes as no surprise to anyone, that I was exhausted, compassion fatigue, early signs of burnout, all of these things. I was just meeting every symptom, every symptom that you would need to diagnose these things. My energy really started to get tamped down by the daily stressors of this system. I was kind of shrinking who I was to maintain the status quo. I was becoming more passive than is typical for me. And so the impact of stress on my body was really undeniable. So I was having a hard time breathing. I was having joint pain. I was still having this neck pain. My brain was foggy. I was so tired. And the other things going on, I got married. I had 2 kids close together. I had all these life changes. And I'm just sharing all of this to highlight that pain isn't like just occurring all by itself. It's occurring in some context of someone's life and everything they have going on.
Absolutely.
And this set the stage for my pain to become chronic, because the nervous system can only stay turned on for so long before it gets burned out. And so I don't know, maybe I hurt myself snowboarding. I have no idea. But the context, I think, was, and all of these things that were happening in hindsight were the roots to my pain becoming chronic. And the crazy thing is that none of my providers asked me about like anything but the physical component. So they never asked me about, what was I thinking about my diagnosis? How was I fearing it? Was I avoiding my favorite activities? Was I feeling fulfilled, engaging in my relationships? And so I started to lose faith in the healthcare system that I worked in, the approach as a psychologist that I was using. I was doing a lot of CBT, which is very effective, but it felt like there was this missing piece, like these I mean, also was trying to do it on myself, so maybe that's not the way to go, but you know, there was something missing for me, right? Because I just had all of this fear. So I was losing faith in this expertise that I had spent all of this time pursuing. Um,
Mm.
you know, and so what I often share here is just what I wish my doctor had told me. So I wish she had told me that 80 to 90% of cases involving bulging discs actually heal within 2 to 4 months. So imagine if she had told me that. I wish she had told me that disc bulges are one of the most common findings seen on imaging. And they're actually found pretty commonly in people with and without back pain. So 40% of people my age, if they had imaging done and had no pain symptoms at all, they would actually probably have this on their imaging too. So some of these imaging findings are incidental. They're just normal signs of aging, kind of like wrinkles and gray hair. We all get them, but they don't cause problems for all of us. And what if she had told me just don't fear, we will get through this, you know, all of these
Yeah.
things. Because when I tried all of the fixes they suggested and nothing worked, I had a ton of fear, and I started to feel like a burden for the fact that I had this pain that wouldn't go away. Um, and you know, so that's kind of the story and the way that I pulled out of it. I think it's important to say that it's not overnight. There is no magic wand for pain. I started working a new position at this hospital with a physical and occupational therapist who, I think they're really leading the charge on some of this education that's often missing in healthcare visits. They were doing a lot with management of your energy throughout the day, and also pain neuroscience education. So we were running a pain program, all of us together. And so I was like sort of learning from them as we were treating patients together. And when we started providing education about the science about how pain works to help people kind of reduce threat of pain in their everyday moments, this is where we really saw people change. So we listened to people, the language, trying to teach them how to shift their perspective. And so we were seeing in real time people viewing their pain through a different lens, forming new connections in their brains, and then kind of transforming these everyday moments into experiences that sent safety messages to their brain or healed them. And so along the way, I started to think about my pain less, and I started to experience it less.
Yeah.
And I think in this sort of quest for a solution and discovery, I learned something really important, that when we approach our bodies with curiosity rather than fear, or when we can neutralize the fear, then everything changes. And so my mission, you know, I'm not practicing as a therapist right now. I'm sort of, you know, I loved the education piece. And so my mission now is really to help women cross that bridge, or at least take the first steps with education. This education they're not really getting in their typical treatment appointments.
Yeah.
So that's sort of from start to finish along the way. And I imagine it's really similar to what many people experience at the beginning. And this can go on for decades.
Wow.
Wow.
It's an amazing, amazing story. I just, before I'm like shocked at you were doing this, you were first introduced to this and then became part of more accurate pain science in a conventional medical model, like with a PT and an OT, and you were helping patients in a hospital setting or some type of outpatient setting.
Yeah, so we were at a VA, which meant we had a little bit more flexibility with the types of programmings that we could offer.
Okay.
We didn't have the same limitations as other medical settings with managed care. So we were able to put together an interdisciplinary program for patients based on the most updated pain science in each of our disciplines,
Fields.
and putting that together. And it was really good. It was so good. We were seeing people change their lives in real time. But the problem was that not everybody's appropriate or ready for a program like that. And I think we were seeing, and it was just us. And we can't do that with 50 people at a time. So we would only see eight patients every 12 weeks or so. And And I think there's a portion of that education that everyone with pain deserves to know. And sort of that's my mission, is just to get that out into the world. And there are other people, other voices as well, trying to do the same thing.
Yeah.
Yeah.
Yes, I'd imagine veterans have a lot of chronic pain from many different reasons. But as you were saying, like, but when there's also fear combined with that pain, and if you have PTSD, if you've seen any action, then there's going to be that overlay of there's a wound and there's trauma and there's fear. And if you have PTSD, then you're kind of in that state of fear, which perpetuates what I'm hearing you say. It perpetuates that can perpetuate that pain. Correct?
Oh, absolutely. And
Okay.
especially, I mean, and we can talk about sort of the basic brain science of pain. But regardless of any other diagnoses, PTSD or trauma, just the presence of threat around pain
Sure.
will always keep it going, and it will always make your nervous system more sensitive. And over time, it learns pain and creates it more easily and more often.
Wow.
But then when you add in something like a history of trauma and the nervous system is already sensitive, or PTSD, if you think about it, PTSD and pain can both be maintained by avoidance.
Yeah,
Right.
sure.
It keeps the cycle of PTSD going, but it also keeps it, so if people are avoiding certain movements, certain activities, it just makes the fear that much greater, and it just keeps it going. So there's actually this sort of mutual maintenance when those two things are happening together.
Okay. So
Yeah.
I'm sure you know Dr. John Sarno, his research, his book. Okay. That's the person I first heard about chronic pain and the crossover of fear and emotions. And I remember first starting to learn about the crossover of like trauma and emotional suppression and pain was when I watched a documentary by Dr. Sarno, and we work a lot with chronic illness. And I noticed the crossover of chronic illness with the pain was a lot of it is like emotional suppression, avoidance. I think you said like we start avoiding activities and avoiding beliefs or feeling like something's wrong. I see that hugely in the chronic illness. A lot of sensitivities or allergies will come up because you have a reaction, and your brain, whatever neurons wire together. So it's like, oh, I didn't feel good when I did this. Okay, so now your brain's, to protect you, says this is bad, so don't do it again.
If you think about someone coming in with an acute injury, right? Acute pain is pain that's lasting usually between 0 and 6 months, and anything beyond that would be considered chronic pain. And when you think about those early stages of pain, there are 3 really important risk factors for it becoming chronic. And I think this is kind of what you're talking about and where some of the overlap lies. So there's poor early education across the board with so many chronic issues, chronic illnesses. But when an acute injury isn't adequately treated over time, or someone's not educated, right? So I'm describing my story, and what if there had been just this neuroscience education? And when that happens, the brain and the nervous system, because the pain's continuing, they get better at creating the pain experience. So like you were describing, the more it happens, the more easily it's produced. The second thing is that fear, pain catastrophizing, which is worst case scenario thinking about pain, and anxiety around pain, these continue to trigger that fight or flight response in our body and everything that comes with that. So that sustains the pain experience as well. And then the third thing is hypervigilance of pain sensations. So because this wires the pain response deeper and deeper into our neural pathways. And, and we can get into the kind of the brain science of pain, sort of the basic, because that might help too, but your brain's trying to protect you. But at some point, that protection system or alarm system is becoming too sensitive. It's overprotective. And then it's creating pain when it's no longer helpful for you, but just because it learned to do that. It learned to generalize, one pain situation to many, and everything becomes so sensitive. I've had patients tell me that the wind blowing on their body hurts. That's how sensitive this can all become, and how learned pain can become in our bodies.
Wow.
Yeah. We use the analogy, I can't remember where we first heard it, but of like a car alarm, and you want a car alarm to go off when someone's breaking into your car, but you don't want a car alarm to go off when a butterfly flies past it or a leaf falls on it. And that sensitization, it happens in the body the way you're describing, of where every sensory stimuli or every it can become, any engagement as a human can become seen as threatening to the body in such a sensitized state. And then you are feeling pain or symptoms with every interaction, and getting the car alarm resensitized, like appropriately. You don't want it desensitized, because then it won't protect you when it needs to, but you want it like a balanced sensitization. And that analogy is just like, oh, okay, people really can understand that balance is the key in so many parts of life. So why would it also not be the key with how our body, how our nervous system uses our whole very complex processes to determine what is safe, what is not safe, and how that can just get off kilter and cause a lot of pain.
Mhm.
Yeah, we use the same analogy for pain. It's
Okay.
it's so helpful. Yeah.
Mm.
I don't know if it would be helpful to go into that a little bit with chronic pain. Do you want me to
Absolutely.
talk? Um, for years, we thought of pain as a measure of tissue damage, like
Wow.
the worse the worse the burn is, the more pain we will have.
Sure.
But we know that that's not true, right? Like paper cuts hurt a lot. An incision twice as deep doesn't hurt twice as much. It's not just physically like a physical phenomenon, right? So instead, we now think of pain as this sophisticated and complicated protective mechanism, threat detection system that's based on our evolutionary need to survive. And it's actually really important. It's a signal for guiding our behavior. It motivates us to take action to keep ourselves safe. So it's the thing that keeps us from picking up groceries with a broken arm, or removing our hand from a hot stove before we get burned really badly. And when we're navigating the world, basically we're doing two things. We tend to look toward rewards, and we tend to avoid or look away from threat. And our threat detection system helps us do this. So to work well and keep us alive, it has to be able to predict to some degree, right?
Right.
So if it wasn't doing that, or at least trying to, we would be reacting to every perceived threat or stressor around us, and that's just not sustainable for our bodies. So it's our brain's job to predict where the threats are. We know it's hard to predict. None of us have crystal balls. We know how poor we are at actually predicting sometimes. And similarly, our pain prediction system can be off base sometimes. And the brain has this internal model of, how much pain it's expecting during any particular moment or experience. And it also receives input and signals from our body. And so the experience of pain is basically a combination of what the brain is expecting plus the signals it's receiving from the body. So this is kind of how it works. And this is what you were talking about with the car alarm. So it's basically an alarm system. It's made up of the brain, the spinal cord, nerves, and sensory receptors or danger detectors. And these danger detectors are distributed all over our bodies. They act as the eyes of the brain, and it's the brain's job to protect us. And so these danger messages danger detectors or receptors send messages from the affected area of your body. So if I step on a nail, it sends a message from my foot through my spinal cord to my brain, and then my brain, using all of the information that it has, which is so much. It could be past experiences, memories, emotions, trust, feelings of safety, what our senses are doing at the time. The brain, using this information, will produce pain if it thinks we need to be protected. And so I think this knowledge of just that sentence, giving someone that knowledge, which most people don't realize, it can really neutralize the pain for them, because it's saying, look, this process is happening in your body. It's supposed to be protecting you, but something's going awry. So what I'm saying is that, at the center of what drives continued pain is how threatening we think the pain is.
Yeah.
Depending on how much threat we perceive, it can drive avoidance, depression, anxiety, distress, and more pain. But when pain is perceived to be low threat, we can escape from that loop or that cycle of fear, avoidance, and pain. And, when someone's had pain for 6 months or years, usually there's some nervous system involvement there, because our brain's always trying to play detective, trying to figure out what's happening in the world in our bodies. It's basically a best guess scenario of the threat detection system trying to figure out how to protect us. And sometimes the threat detection system suggests injury, danger, or threat inaccurately. And when predictions or beliefs about threat are repeated over and over, they become stronger. They become more resistant to change. They become learned by our nervous system like a reflex, and pain is produced more readily, more easily. It doesn't take much of a trigger to set it off. And so your nervous system has learned to stay in high threat mode. Your brain has become overprotective, and it keeps pain going. And so the important piece here, and so I guess listeners, if you're multitasking, come back to this, because if your brain believes that there is a threat that makes you vulnerable, and that could be as simple as the MRI your doctor just explained to you, it will protect you by creating pain. And when the brain believes that you are safe, it won't create pain to protect you. And so there's a lot to say about that. I go into it in more detail. I'm doing one more webinar in December that's free, because this is kind of the piece that I think everyone should be able to understand, and they're just not getting it in their typical appointments.
You explained that so well. And
So well.
I'm thinking of so I have a history of chronic pain, and that is one area that I'm still recovering from. I came into the neuroscience, brain rewiring world with over 70 symptoms, and it's been quite the journey of rewiring so much, and it's been remarkable. And I have a lot of personal experience with what you're describing, and you just describe it so well. And the empowerment of the education, it's hard to state how empowering. It's the only word I can think of, to know what's happening. I remember one time I was talking to my friends about my pain, which I've had chronic abdominal pain, chronic joint pain, chronic headaches, neck, back, and those are the main ones. So I remember telling a friend before any of this for my own journey, just explaining how terrifying it is to feel the oppressive emotions once the pain came. And I didn't have words to even understand what was happening, right? I just knew, so the pain comes, and then there's the tear and the disappointment and the despair and the discouragement, and then the behaviors that follow those emotions, and this vicious cycle that just felt so oppressive and so disempowering. And looking back, like that, I was in that trauma loop, or that limbic loop, or that pain loop. It was such a patterned place. And so part of my recovery that I'm still walking out has been me learning how to signal safety, and how to disrupt that loop, and in a sense tolerate the pain when it comes as a sensation, and not as this is crippling, this is life-threatening. Like cognitively, I think a lot of people know cognitively it's not life-threatening, especially once, they've ruled out cancer, or, something that is life-threatening. But emotionally, my felt experience was not that it wasn't life-threatening. It felt life-threatening to my body. And so changing my orientation with my emotions that are connected to the pain has been really, really important. And I'll say, you probably see this with the people you work with. It's like, that's probably the hardest part, because it's so natural to feel threat when your body feels pain, and for that to just blossom, that's not the right word, to just
Mushroom
take over.
cloud.
Yeah. It's a lot. It's really challenging, but it is possible.
But that pain cycle you're describing is so common and it's so easy to fall into. So, when we would work with people in this program, we were like, you have to understand this cycle because you will find yourself sometimes falling back into it. It's so easy, right? Because it's hard not to view pain as threatening. It impacts our lives so much. But the cycle is really important to understand, and it's kind of a downer, right? Like it's really easy for us to fall in the cycle, but the good thing about the cycle, I think, is that there's actually all of these places within that cycle that we can break it,
Hmm.
whether that's cognitions, emotions, behaviors. um, there's so many education, there's so many places to break the cycle, and if you can equip people with the right education and the right tools, they can, maybe they'll fall back into it, but they can always come back out of it, or maybe
Yeah.
they,
Sure.
and I think for a long time a lot of the treatments for chronic pain focused on helping people accept pain and manage day to day. I think there's a lot of really great science coming out and treatments that are helping patients overcome their pain, but it's important again to remember that pain isn't the only thing occurring. There's a context in which these symptoms happen, and that's why it's important to understand that cycle and know how to come out of it, because maybe a stressful time of life will bring it back, or maybe a new injury of a new kind will bring it back. So it's always, that journey can look different for everybody, but that's why that cycle you brought up it's so important to understand that.
So I got a question that I think might be helpful for listeners. It's definitely helpful for me because like somatic pain or emotional suppression pain, that kind of makes more sense to me. Or I guess I can understand it better. But when there's like an injury, so I'll take for me, for example. So like a chronic injury that keeps on coming up. I was told I tore my groin when I was like 19 years old. It was very painful. It took a long time to heal. But even when it didn't hurt, it would still get locked up. And then it would get hurt easily. And so I feel like anytime I run, I pull my groin. I injured it like 4 months ago again, and it seems like it's staying around a little bit longer this time. And so like, is there a difference? Like I can see that it could be like stress, it could be like stuck wiring. Is it, if there's like structural damage, is that different for pain wise? Yeah, I mean, or is there overlap? Like it's been 20 years, should it still be causing issues? Or, so I know as we get older also, like we feel things a little bit more, but also is that a wiring? So just for our listeners and for me, like as a lot of us have dealt with stuff growing up, and if it sticks with us, I know you can't say like it's always this or always this, but I just like to hear you speak on that a little bit.
I think there's a lot of people that would say pain is pain, whether it's a groin injury, a disc bulge, degenerative disc disease, fibromyalgia. Pain is pain. And most tissues in the body heal within 3 to 6 months.
Mm-hmm.
And so they would say that beyond that, what's maintaining your pain is not damaged tissue, or at least not that by itself. And so factors that are known to be associated with pain include physical, so the history of the groin injury, psychological and social social factors as well. And so we would look at sort of the context of which this keeps coming back. But I think the thing that I wanted to say, which maybe is going to be more black and white than what you expected, that regardless, pain is always coming from the brain. Because you could have this groin pain and never have had an actual tear diagnosed, or, I don't know,
Right.
there might have been nothing on your imaging,
Yeah.
or there might have been something on your imaging and then now it's healed if we looked back at it,
Right.
right? And you could have this groin, I don't know how that shows up on imaging, but like you and I could have the same injury, the same imaging, and you would have no pain. You could have no pain at all, and I could have severe pain out of this world. So there's too many things about pain that make it more complicated than
Sure.
just an injury.
Yeah.
And that's because it's created by the brain. And maybe there are these moments where the brain is remembering, and it's trying to protect you. Have you guys ever heard of Lorimer Moseley?
I haven't.
So the pain education group that I love to follow is called the NOI group. And there's one guy in particular, Lorimer Moseley. He's in Australia. He's a physical therapist and a researcher, and he's funny and he's charming. And I'm a total groupie, and I have followed him to like a conference. But anyway,
I've never heard of him.
I hope he never hears me talk about him. But anyway, so he's got all these great YouTube videos, and he's funny. So he tells these funny stories that patients can relate to, and these metaphors. But one of the stories he tells, and I don't know if this will help you, is that he tells the story about how he was going on a hike with a friend. Beautiful day, they're chatting, they're walking, and then he feels something brush against his ankle. His brain is like, well, we're walking around here and it's kind of hikey, so it's probably just a scratch from a twig. They sit down a few hours later for lunch, and he looks down and they realize he's been bitten by a poisonous snake. His brain is like, whoa, you were bitten by a snake. He experiences tons of pain. He goes to the hospital, is treated, and he's fine. So 3 months later or whatever, he's on a walk, same friend, same place, beautiful day, they're chatting. He feels a little something on his ankle, and his brain remembers, and his brain says, whoa, last time we were here, we got bit by a snake. Let's make sure you feel a ton of pain. So you like look at your ankle this time. And he looks down at his ankle, and it was just a scratch from a twig. And so, he tells the story in a much funnier and more charming way than I did. But I think, context is really important.
Yeah.
The protectiveness of our brain, and there's no, magic wand, like I said, for pain. So the brain remembers. The brain's always going to try to protect you. And so I think sometimes people can be feeling better, and then there's still that little part of the brain that remembers, right? It takes a long time to get rid of those pathways.
Yeah, because like as I quote unquote re-injure it, it's always like during sports or something. So it's like, oh yeah, of course I did. And so it makes sense, but like it's not like this. It doesn't seem to be something like drastic where I like when I first injured it. So that makes a lot of sense that my body's more sensitive to it. And also,
maybe you do re-injure it. I should say sometimes that people can have acute pain on top of their chronic, right? And perhaps you did re-injure it, and that's a different, kind of you should get treatment and rule out any red flags of things. But yeah.
Right. But I've also had experiences where I remember like playing sports, diving, and having a cut up my knee and not knowing it until somebody told me. Like I had no pain. Didn't even know I was cut, but like blood's gushing down my leg, and like someone's like, "You're cut." I'm like, "Oh," and so like you said, the pain is pain. If I knew, like, I've also been cut other times and known it, and like, "Oh, that hurts," but that one I didn't feel it until somebody brought attention to it, which is interesting.
Pain is tricky. Pain is tricky. Your brain doesn't think it needs to protect you in that moment. It won't.
Exactly. Yep.
That's
fascinating.
The video, the story you just told of the funny Australian guy that I'm going to look up. This this type of scenario has played out so many times. And I'm sure as listeners are hearing this, they're like, oh my gosh, because like you said, pain's seen in such this black and white mechanistic way, and it's just not. It is so, I like how you use the word sophisticated. And while it drives us crazy when it becomes a problem, we can like kind of be in awe of how incredibly non-simplistic this process is. I got diagnosed, right? It's remarkable. So this was several years ago. I got a diagnosis of Lyme disease, and I was in upstate New York, and we had met many people that had gone on to develop like a chronic Lyme presentation and years of suffering. And so I had become very aware of what Lyme could do long-term, and was very fearful of it for sure. But this was in the middle of my chronic illness, trying to figure out what was going on, looking for diagnoses. And I remember this day, I'll never forget it. I heard back from my doctor, and the test results had come back, and I had tested positive for Lyme. And I remember telling Luke that night in bed, like, okay, the results are back. I do have it. And the leg pain. So I had some joint pain. That was why I got tested on and off. But what happened that night, I felt like, and this is a bit of a trigger warning, I'm using strong language. I felt like my legs were breaking. And the pain was so profoundly intense. Like I just wanted to squeeze them, or I needed the pain to be contained or stopped somehow, because my legs were, and not even joint, just like bone marrow pain, just incredible amounts of pain. And in the middle of it, I had no concept that my fear was creating this pain. I didn't know. So of course, because I didn't know that, I was terrified. Like, what is happening? It's so bad. Like, and I was an ER nurse, so I wasn't going to like run to the ER, because that's not what ER nurses do. But if I wasn't, I would have been like, something is absolutely wrong. I need immediate medical attention. And you know, that would have crossed my mind, because it felt so significant. So looking back on it in hindsight, I'm like, that is remarkable how much pain, the level of pain that was produced with a diagnosis, just like that.
Yeah.
Remarkable.
You know what?
You probably hear these stories a lot.
Yeah, it was so
Sorry.
funny. So I went to a doctor because, you know, I still, it's not like my neck pain is cured forever. Sometimes it comes back. And we moved here to San Diego, and I wanted to find a provider just so I knew I had a place to go where I could get acupuncture or physical therapy or whatever, because managing pain, I'm not swinging the whole other side of the spectrum either. Chronic pain is still about the physical management too. And when I got there, the first thing before I even met with the doctor, they wanted to do scans of my neck and my back. And so I go in the scan room, and I'm trying not to be like the patient who's causing issues for their protocol. And I'm about to lay down or whatever. And I just said, yeah, you know what? I don't want a scan right now. I'd rather talk to the doctor first, because I didn't want that to happen, what you described. I didn't want them to incidentally find like, who knows what's happening as my body ages. If I have as much degeneration in my spine as I do gray hairs on my head, like that would have been a really bad day. And I told the doctor that, and she, you know, she's like, I totally get it. That's fine. You're not having there are no red flags here. You know, she asked me some questions. She said, we don't need to do imaging. It's okay. And, but that was exactly why, because I didn't want that. I didn't want to know if I didn't need to know.
Right.
Yeah.
That's just a great also word for like advocating for yourself. Like in your journey, it's, yes, we want to listen to professionals, but there's also knowing what you need to know, and knowing what's good for you, and knowing what's helpful for you and what's not helpful for you. Would you agree with that?
Oh, totally. And I think people don't, I mean, I think a lot of people would have gone in and not realized that they don't have to get
Exactly.
But the other thing that's on my mind too is, you know, I'm so sorry to hear you've struggled with this groin pain over the years, and a Lyme diagnosis must have been so like life-changing in a negative way for a while. And like these symptoms that you had, they sound really hard. But we're the three of us are sitting here. We've all had chronic pain. It's coming for all of us. It's just, part of life. We will all experience pain to some degree. Your provider, for the listeners, your providers have chronic pain too. It doesn't just happen to certain kinds of people.
Right.
It's so common, and we should kind of take the stigma out of it, I think, especially for pain that just won't go away. There's a lot of stigma tied to that. And it can really happen to anybody.
Yeah. That's a great word and great encouragement. There's so much, like, chronic struggles are stigmatized in general. We don't want to be labeled. We don't want to be inconvenient. We don't want to be
Weak,
out,
broken.
weak, broken. Yeah. And so, yeah, I think we've come a long ways in mental health. But yeah, pain, I think, is one where it's either fix it or deal with it, or try to fix it. But to understand it from this perspective, that it's not necessarily something that needs to be quote unquote fixed, it needs to be understood and acknowledged and cared for. And if you have it, it's not because you're weak, broken, and you're doing something wrong. It's
because your brain's protecting you.
Right.
And that's it. Yeah.
Yep.
And we have to figure out why.
Yeah.
We have to figure out why your brain's protecting you so much.
Yeah. And if there's trauma in your background, then it's like, of course your brain's protecting you. Like, it's learned to protect you. And now it's adapting to protect you in this situation this way.
Yeah.
Yeah. And just seeing it from that perspective again, like, I work with a lot of people that addictions, like, that's an adaptation that your brain's trying to protect you. It's not helpful, but in the moment, it's helpful in what it's supposed to protect you from, not in health. But with pain, it's also adapting and protecting you from something. It's not helping you be active, but it's protecting you from this other fear that it doesn't want you to experience.
Right. And it's often about, at that point, kind of, so the good news, right, is that neuroplasticity, or sort of this learning of our nervous system, it can go in that negative direction and overprotect us, but we can teach it to go the other way with education and new experiences. And, a lot of overcoming chronic pain or reducing the flare-ups that interfere with life so much is the recalibrating of the nervous system. So how to kind of, turn down that sensitivity of your nervous system, reduce that perceived threat and the danger messages to the brain, and replace it with messages of safety. And that's kind of just, it's like, if you can figure out how to retrain your brain, that's the hack. That's the life hack for chronic pain. Yeah.
Love it.
That's our growing work, and it's so powerful. I feel like it's the best surprise for us of the decade, maybe I don't even know. It's just like, no way. This is applied neuroplasticity. It's not just theory. The brain can actually adapt and go in the positive direction of helping you have the flourishing, full, joy-filled life that everyone longs for. Like, the brain's a massive player. And I love that we can leverage the power of the changing brain to do that. It's just there's so much hope in it, and to see it play out in real time for people is like, man, this is sweet. Like,
that's so well said. I totally agree 100%.
Wow. So is there anything, I don't want to take more of your time than we have, but I would just love to hear if there's anything more you want to add. I know you specifically work with women, and we'd love to hear, like, your heart behind that, why you focus on women, and maybe some last principles that you would love to throw in on that are important when recovering.
I guess I focus on women. There's this really old kind of pain model. It's called the onion model by John Loesser, and it describes the pain experience as sort of being 4 layers of an onion, with the inner layer being that physical injury, moving outward, kind of pain is this unpleasant experience, moving outward, that suffering and emotional response. And then when you get to kind of the outside of the onion, it's the nonverbal expressions of pain, or the way that someone presents themselves to the outside world. And then outside of that onion is our society, the system, the outside world. And I think that the outside world of that onion for women is full of just a bunch of long-standing issues. And,
Yeah.
you know, I sometimes here I kind of go into a brief history about the word hysteria, but
Mhm.
just kind of this idea that these really common symptoms that are synonymous with normal female, you know,
Mhm.
sexuality and functioning, or, you know, was really um, taken out of context. And I think it still exists. It's just sort of, it's alive and well, but it's just sort of rebranded now. So you can see unexplained symptoms that might have been labeled as hysteria before, now psychogenic, psychosomatic, medically unexplained. So I think that this idea, you know, conventional medicine kind of approaches pain in this funny way, where they feel like the mind and the body are separate, when we know that
Mhm.
they're continuously and unquestionably connected,
Yeah.
but that if a physical symptom can't be explained physiologically, then it must be attributed to our psyche. And this default attribution is really dangerous, I think, particularly for women who are being made to feel that pain is all in their head, when in fact pain is always both.
Yeah.
There's a lot of gender bias around chronic pain. Um,
Hmm.
you know, so women report more pain, they're less likely to get their pain treated, they're less likely to be given a diagnosis, they're less likely to be studied in clinical trials. They, you know, and then due to societal expectations, women face all of these complex demands, and they're trying to manage their pain and the demands of their households or their role as a spouse or partner or mother simultaneously. They feel mistrusted and psychologized by their providers. And interesting, you know, the appearance of women with chronic pain is judged by doctors. So you're either looking too good to be sick or unreliable if you don't look good enough, right? And
Wow.
so, you know, what are we communicating to women when this is their experience at the doctor? We're giving them experiences that cause them shame, misunderstanding, distress, trauma, sadness, invalidation, a fear of speaking up. They become a woman unempowered.
Hmm.
And when you bring these feelings into the cycle of ongoing pain, it just adds more distress, more pain, more sensitivity to the nervous system. And sorry, I'm going on and on because I feel really strong. You know, I think
That's good.
beyond chronic, beyond chronic pain and sort of gender bias in healthcare, going back to that outside of the onion, the environment that surrounds it, I think we have to appreciate the burnout that women in particular have been feeling, especially over the last couple of years. So many women I know, high performing, you know, women, those that are mothers, especially, people are exhausted, they're struggling, or they're even broken, feeling broken. And, you know, we just had the pandemic, during which the vast majority of unpaid labor was being done by mothers, by women. They sort of, you know, I'm here in America. I think we became America's social safety net for the past couple of years. And so,
Mhm.
you know, why do I provide education for women? Because they just are not getting it.
Yeah.
Yeah.
Women represent a huge portion of the chronic pain population. They deserve to understand what pain is, how it works, what's happening in their bodies, and what to do about it. And they deserve to be validated,
Hmm.
trusted, heard, and understood.
Yes.
And so that's why I try to provide a lot of that for free, like I said, because I think so many people, women and everyone, deserve to have this information, this education. So I have a lot on Instagram at Dr. Anna Redmond. I do a free webinar, and I'm going to be doing my last one for a while, December 12th at 11 a.m. Pacific time. So people can sign up to that at links.drannaredmond.com/webinar. And then in terms of, I do have a course that I'll be running the education for live in January. And this course is really just to kind of like give women a deep foundational understanding of why they still hurt, and then teach them how to use that brain science give them the education they need to kind of basically redesign their day to get through it without the crashes, and kind of redesign their lives to match what they really want. So that's kind of what I'm all about. That's why I chose women. Yeah.
I love it.
Amazing. Definitely got goosebumps as you were talking about
Seriously.
this. Yeah, how needed this is, specifically targeting women. Wow, just thank you so much. We could not admire or honor your work more. This is so incredibly needed. I left the mainstream medicine like 5 years ago after working in the ER for 10 years, and I just left like so discouraged about how few people were getting the help they needed. You know, if it was like emergent, yes. If it was, oh, they need the cath lab because they're having a heart attack, or they need surgery to take their appendix out, great, awesome, wonderful. But then all of these people that fell through the cracks, they didn't fit in a perfect box, or even they did fit in a box, they had the surgeries and they came back still with pain, still with problems. And I'm so highly empathetic that I was just dying in that setting, not feeling like I could actually help people. And so like to see other providers and other folks in this big, the bigger healthcare field, including mental, physical, all the things, to see the information being disseminated and people having resources is so encouraging to me. And it like has brought back life to a part of me that just kind of withered away of like, okay, and powerlessness of like, I cannot help, and compassion fatigue and moral injury and burnout, because wanting so badly to help people, but it just feeling like impossible. Seeing people doing it and being people that do it, it's incredible. It's such a high.
Yeah. We have similar experiences, I think. I totally agree.
Wow.
Well, thank you for your time, Dr. Redmond. So informative, so helpful, so good.
Yeah.
And we'll put links in the show description. So go check out Dr. Redmond, all of her things, her website, her webinars. As you can see, just getting a glimpse this hour, she's got a lot of information.
Yeah, this is
Thank you so much. You're so kind.
Well, I'm so glad we connected, and that we're networking with like-minded people is just a thrill.
Yes.
So we're so glad, to introduce you to our audience, and find her on Instagram. And it's wonderful. Carry on the wonderful work you're doing.
Thank you so much. You as well.